Okay, good morning, everyone. Can you hear me okay? Yes, great.
Good
Okay,
morning.
and you guys can see my screen okay? All good. Okay, all right. We're gonna get started. So good to see you all. Just so you know, we're recording, and this recording will be shared out after the meeting, but really glad to see you all on this Friday morning. We're going to go ahead and get started. So, September is National Self-Care Awareness Month, if you didn't know. It is a month that's been set aside just to acknowledge that we all need to take care of self, especially in the work that you all do every day. It's so important. So if you could, as you introduce yourself in the chat, if you could also take a moment so your name and organization, and share your best self-care activity. We're gonna share some tips here in our chat this morning. So if you could take a moment, if you haven't already done that, oops, sorry about that, and then share your name, organization, and your best self-care activity. Okay. My name is Giovanna Vialdoris. I'm a member of the First Five team here, and one thing that I enjoy doing is just going for morning walks. I stopped doing that for a little bit and I just started back up, and it is just a wonderful way for me to start the day. What do you all do? Let's see. Good morning. Good morning. Let's see if I can see some of your responses. Working out, meditation, enjoy nature walks. Same, Mercedes. Enjoy it as well. So just go ahead and put your name. Baking. Oh, yes. I'm going to send you my address just in case you have leftovers. Face mask and C drama. I don't know what that is. C drama. That K drama, like Korean dramas, maybe? Or am I missing something? China. Thank you. Chinese drama. Thank you. Thank you. Yes. Unwinding at home, lighting candles. Yes, I love to light a good candle, read a good book, meditation, puppy yoga. Did not know that was a thing, but it sounds wonderful. Love going water aerobics. Yes. Okay. You guys have some great tips. So feel free to mine our chat for some self-care tips that you can start doing yourself, because there's a lot of good nuggets there, and we're gonna push on. Okay. All right. So we've got self-care, acknowledgement. Um, in the chat. So please take a look at that. And if you're just now joining a few minutes late, welcome. Please be sure to drop your name and your agency and your self-care tip in the chat. All right. So just in case this is your first time, welcome. This is our gathering for agencies that provide services to young children and their families in San Joaquin County. And so this is our time for gathering virtually. This is our place for sharing resources and spotlighting different topics, and to have discussion to the extent that we can engage, in these virtual settings. We like to do that here at Community Links. And so we welcome you to do that. If you have not turned your camera on and you're willing to do so, we love to see faces. We love for our presenters to have faces to speak to. So we invite you to do that. We are, casual and informal here. So if at any point you have a comment or a question, please feel free to drop it into the chat, or you can unmute yourself and share. All right. Okay, so just a quick review of our agenda today. So we've got some September observances we want to acknowledge. We have a presentation on emergency preparedness, which we're just a really good timing for that, because this is Emergency Preparedness Month. And so really grateful to have Representative Gwen Calloway from Public Health Services here with us to present on that today. And then we'll have some large group Q&A questions, and before we wrap up today, we'll have time for you to share any updates and any announcements that you all have. All right. Okay, so our first acknowledgement or observance that we want to acknowledge today is that our September is Library Card Sign Up Month. So we have really great library resources here in our community. We have some great library partners that have presented a few times here in our community link space. And so it's just a great resource to our families. I was really excited, to know that our library has library cards available to kids under the age of 5. So there's no age, restriction on library cards, which is really great for promoting library access for our families with young kids. So Library Card Sign Up Month, great opportunity to promote library connections with your families. It is also Hispanic Heritage Month. I just did a quick search to see what was going on in our community, and there's a lot happening. So between September 15th and October 15th is the Hispanic Heritage Month. So please check out local offerings because there are lots of different events going on to celebrate Hispanic culture. It is also National Suicide Prevention Month. We have various partners in our community that offer, different supports. But please check out, just want to spotlight Child Abuse Prevention Council. They've been with us before to provide training on suicide prevention and awareness. Oops, sorry for that. Please check out their site because they offer trainings for staff and lots of different resources. So Suicide Prevention Month. It's a Child Abuse Prevention Council is a great resource there. All right. Any observances that I've missed before we move on? Is there anything that you're aware of that might be going on this month in our community that we can take a moment to acknowledge? No? Okay. All right. If something pops up in the chat and I miss it, please let me know. I don't want to overlook anything, but with the screens, it's a little hard to navigate to the chat sometimes. So please feel free to unmute yourself if I miss a comment. All right. So with that, we're going to move on to our presentation today. So again, as I mentioned, it is Emergency Preparedness Month. And so we have presenter Gwen Calloway, who is the Emergency Preparedness Coordinator here in San Joaquin County. She's with San Joaquin County Public Health Services, and she's a great resource to have share with us today. And so with that, I'm going to turn it over to you, Gwen, to stop sharing.
Awesome. Okay, thank you so much. Okay, I will start. We perfected this like
We
10
sure
minutes ago.
did.
So let's try this again. Oh goodness. All right. Okay, let's double check.
All good.
Oh, beautiful. We
Yay.
love to see it. Okay. All right. Well, thank you everybody for having me today. I very much appreciate this opportunity to come and present for all of you. I don't get to very much anymore. But for anyone who's been around here for a couple of minutes, I actually started out here at Public Health at the Child Health and Disability Prevention Program, or CHDP, if you remember those folks. I was the health educator for that program for a long time. So I have a special soft spot for kids and families and our Medicaid folks, Medi-Cal folks in particular. So I'm very happy to kind of get to revisit all of y'all working in this space. So I'm very happy to be here today. Luckily, we get to talk about something that is very helpful, hopefully, for kids and families. So let me. Okay. So basically, I want to talk about like what is exactly emergency preparedness because we hear this term all the time. And the truth is, it means a lot of different stuff. And it really depends on who you're talking to. For those of us who work kind of in the field, we have a lot of technical jargon. Emergency preparedness, emergency management as a field is very famous for having lots of jargon. A lot of the terms come from like the military and from like firefighting and law enforcement and all these things. And for those of us who work in public health, or who work more on like the social services side of things, those two points of view don't gel all the time. Like there's can be some friction. So I think of our job here at Public Health kind of straddling these two spheres as we're kind of like the interpreters between the two sides. Because we work in the public health social services sphere, but our subject matter expertise is in emergency preparedness, emergency management. So I wanted to kind of provide both sides of it so that you can see, kind of where we're coming from and what we actually and what we mean and what that means for the community and those of us who work, very closely with the community. So for EP professionals, we have this kind of technical definition, which is what we have to worry about. But really, what it means for the community is the steps that you take to make sure that you are safe before, during, and after an emergency. Just very broadly. And safe can mean a lot of different things, right? Safe, mentally, physically, emotionally, all these things. Not just you yourself, but where you live, your family, all these kinds of things. But all of us are working towards the same goal of increasing resilience in the face of an unexpected event, which we will absolutely talk about as we move forward. But really, the reason that I'm here, I just wanted to introduce EP a little bit, but the reason that we're here is because it is, as we heard earlier, National Preparedness Month. And the 2025 theme, there's a theme every year. That the federal government kind of puts out. And so this year is Preparedness Starts at Home. And it consists of these four lovely steps. So know your risk, make a family emergency plan, build an emergency supply kit, and then get involved in your community by taking action to prepare for emergencies. And we'll talk about each one of these things and kind of how it would apply to our community at large, to families individually, and see, kind of what that translates to as we work with our folks. So know your risk. This basically just means know what could happen wherever it is that you live. If you live by a levee, for example, is it, fairly well maintained? Does it get really high? Is there a chance of flooding, for example? If you live, more out where there's like kind of in the rural areas, are we thinking about wildfires? And then really almost no matter where you live, we consider things like infectious disease outbreaks. That kind of stuff happens all the time and could affect anybody. And then of course, this is San Joaquin County, right? This is the Central Valley, right? It's hot. Like every year. It's very hot. Luckily, it seems to be actually kind of nice this week, aside from this weekend. We don't talk about that. But it seems to be actually fairly nice right now. But generally, we're always thinking about extreme heat as well. So we want people to know the risks where they live, basically. And part of our job as EP professionals is our job is to figure out those risks. We call it a jurisdictional risk assessment, which is just a very jargony way to say what could go wrong. We're professional what if people, basically. We're always thinking about what if this, what if that. If it happens, what can we do? Um, and so it's important to understand what might happen. And we'll talk about this third bullet point, the getting information on local hazards and risks. sjready.org is a fabulous resource for San Joaquin County. We'll talk about it more in depth, so don't worry about having to remember that right now. But that's our local resource for understanding local hazards, local risks, what we want to be paying attention to as we go throughout the year. And then step two, make a family emergency plan. This is honestly probably the best tip that I think we can give people, because now that we know what kinds of emergencies we have here in San Joaquin County, we can sign up for local alerts for those risks. So if there's going to be a power outage, if there's going to be a blackout, if there's going to be a brownout, if there is an evacuation order because, a levee has overtopped, there's going to be a little bit of flooding. We get a lot of storms, some big storms in the winter time, right? Sometimes. So if you're in a low-lying area, if you're next to a river, something like that. So it's possible to sign up for local alerts so that you get notified when something happens or when you should be on alert for something. We will also talk about that more in depth in a minute. So stay tuned. It's going to be exciting. But it's very important for these emergency plan components, especially that you do them in conjunction with the rest of your family. Planning is a communal process, right? If we just make our own private plan and then we don't tell anybody, you can do that, I guess, if you're by yourself, okay. But it works better when you tell people about it because we want to know, if you need to evacuate, where did you go? Are you safe? What's going on? So plan with your family members, with your friends, for example, where you will go if you'll evacuate, locate typical shelters in the area. Typically, these are community centers, maybe some high schools. Those are usually places that open up. I have seen, for example, the fairgrounds, the San Joaquin County Fairgrounds here in Stockton be considered a couple of times. So in our county, that tends to be where they are. It's also important to record important contact and medical information for your family on paper specifically, because in emergency, you never, your phone's going to die. There's no place to charge it, even if you have your charger. Maybe you forgot your extra battery backup, but have it written down on paper. So maybe you need to borrow somebody else's phone, maybe you find a landline, and you're still able to have that, as well as medical information, so that, as we know, electronic medical records are electronic. And but if the system is down, then if you need to access healthcare in the event that their system is down, or in the event of a wider power outage, then you still have that information available for them and you're able to get your care efficiently. So we recommend recording important stuff on paper. And then of course, any important documents, we're talking about like birth certificates, passport, social security type stuff. If anything like that, go ahead and store that in watertight bags and put them on a high shelf. Just like make a copy, doesn't have to be the original. Make a copy, put it in, a resealable type of bag, and then just they're for in the emergency. So just put them on a high shelf or on a second floor, or if you already live on the second floor already, then probably any shelf is fine, honestly. But just as long as you remember where they are eventually. We want to make sure we have a copy of those and that they're kind of out of harm's way in case we need them. And then there's tons of free preparedness resources out there. Our website, Public Health, we have preparedness resources. Our Office of Emergency Services here in the county, OES, they have resources. Listos, California is a fabulous, fabulous list of resources. FEMA, Ready.gov, the Weather Service. All of them are very plugged into emergency preparedness, and I'll show you some where you can access all that later as well. Number three, building an emergency supply kit. Now, this one I know people kind of get a little bit hesitant about because they're like, well, my clients, these families, they're really not looking to spend $200 to like buy a pre-made kit. Like that's really not accessible to them. And I completely agree. I absolutely understand. I think, just telling people to buy a $200 kit where half the stuff is just going to expire in 6 months anyway is not a great way to kind of go about this. So what we really encourage is that folks build their own kit, and you don't have to do it all at once. It's something where you can kind of gradually accumulate items as long as you have one place where you can put them. And that it's easily accessible in the event of an emergency. That's really the most important part. It doesn't have to be something fancy. It can consist of things that you pick up as you go, or things that you already have on hand, but maybe don't use every day. Um, you can check garage sales or thrift stores or anything like that for useful things that you might want to consider tools, camping gear. Again, power outages here are just kind of a fact of life, especially in our more outlying areas. Backpacks, which honestly, not just for emergencies, that's great for everyday life. Backpack makes your life easier, right? Um, and then of course, when you're building your kit, consider the unique needs of your family. No two families are the same, right? One family member has a medication that they need to have. Another family member has, special medical equipment that they need. Maybe this family has two kids under the age of 5. Maybe this family has a college student and a high school student and an infant. Who knows? Maybe we're living in a multi-generational household. Maybe we've got, baby parents, grandparents, great grandparents. All of their needs are going to be wildly different. And so we just want to make sure we're considering all of these things. Because even though with a kit, it does take a little bit of investment. There are ways absolutely to reduce that, or to mitigate that cost. But planning, just thinking about, okay, writing down contact information, figuring out an evacuation plan, all that's free. And so we really try to emphasize the planning portion of things. And then I have just here's some examples of things that could go into an emergency supply kit or like what we call a go bag, which sounds very dramatic and very action movie. But it just means a bag that you can just pick up and go when you need to. Because sometimes when there's an evacuation order for a flood or maybe a wildfire, there's just not enough time to go around and collect everything, especially if you've got small kids. You're trying to get them dressed and herd them into the car, and it's just, someone's crying. It's just a very stressful situation. It can be for everybody involved. And so this is just us trying to help you reduce the stress because it's going to be stressful no matter what. Emergencies are stressful. But you can put, flashlights, extra battery, your charger, let's see, copies of those important documents like we talked about, any hygiene items that you like or prefer or need, water, of course, non-perishable food, very important. Maybe older clothing that still fits. So if there's something that maybe they were going to donate, put it into your emergency kit instead. Um, We'd absolutely recommend that. Extra medication if possible. That's something you can ask like if they have a PCP, primary care physician, or a pharmacy, for example. I know for inhalers, for our kiddos or really anybody with asthma, you're able to get, I think, an extra rescue inhaler just for emergencies. That I believe is covered by insurance, if I remember correctly, but I might have to double check myself on that. But extra medication for anyone in the family that has medical needs. Pet food, if there are pets involved, we don't want to forget about our pets. It's very important. So pet food, but really anything that pet needs to be taken care of. And then, of course, any children's items. And of course, this is absolutely going to vary with the age of our child, but could be anything from that special blanket that they cannot go anywhere without, or there will be a meltdown, to a puzzle. Because maybe once you evacuate, you end up somewhere. Parents, grandparents, whoever might be trying to figure out insurance and, connect with other family members, and they're taking care of all that stuff. You need a way to occupy the kiddos while the adults take care of whatever the situation is. So, puzzles or, a screen time item. I won't get into the whole debate about screen time and kids, but in an emergency, I think we can be generous to ourselves when it comes to that, and just allow ourselves to, do what we need to do in order to take care of the situation. Okay, and then get involved. That's the fourth step, is get involved. And that can be something as easy as just check on your neighbors. It doesn't have to be a huge formalized process, but we like to say in EP that half of being prepared is just being a good neighbor. Half of emergency response is just being a good neighbor. When we can, get to know your neighbors if that's possible for you. Check on them, especially if you have older neighbors who maybe don't have family who live around. Just, do they have a ride? Is their power on? That kind of thing. So just doing a check every now and then if that's something that's available to you. And then just generally being proactive. That I know that there are a lot of competing priorities out there. We are busy. Kids are busy. Like there's a lot going on. Everybody's working in this economy. Everybody's working. Okay. I fully understand that. Being proactive is, again, can just be as simple as, a conversation that a parent or someone, that you have with, an aunt or a grandparent or a friend, just saying like, oh, hypothetically, if our the road was closed, maybe we go around this way, maybe we go this way. What if there's a flood? I have a friend who lives in Sacramento. Maybe I would just go hang out with them. We can ask them if, we can come by for a day or two, or, something to that effect. Like it's being proactive, again, can just be that, have a, that what if conversation. We love a what if conversation, right? It doesn't have to be, big and scary, because anything that you can kind of bring down and anything you can make bite-sized, and just consider ahead of time will just do wonders for you later. Something else that we kind of recommend for folks, if you really want to get involved, if you really feel that this is something that you're passionate about, we recommend taking a first aid class or a CPR class or both, because why not? American Red Cross offers, for example, CPR classes. They're famous for it, right? I think just about everybody who's ever taken CPR class, it's probably through the Red Cross. So those are still absolutely available. Something else you might want to consider is what we call a psychological first aid course. Now, this is it was developed, I believe, by let's see, hold on, by I'm sorry, the National Child Traumatic Stress Network, and they have a 5-hour online course. Now, granted, this might be a little bit more for professionals. This is probably a little bit much for families, right? But for those of us who work in this space, I would recommend it. It's again 5 hours online, interactive course. It covers intervention strategies intended for kids, for adolescents, for parents and caretakers, families, adults who are survivors or witnesses or who are exposed to a disaster of some sort. It also covers the provider well-being, like those of us who are doing this work and who are in this space, and who are continuing that. And so it also comes in Spanish, I believe. It's in English and in Spanish, the full course. So with, kind of the emphasis these days on behavioral health, on mental health, I mean, we just heard earlier that September is also Suicide Prevention Month or Suicide Awareness Month. And so a psychological first aid course could be just a great cool a tool in your tool belt. As a practitioner. So would recommend that as well if that's something you're interested in. If anybody's interested, you can just Google the National Child Traumatic Stress Network, like psychological first aid, or I can send out the link, which is very easy. I'm very happy to do that. Um, and then, of course, becoming a volunteer, that could be anything. It could be, if you really want to go for it, the Red Cross always wants volunteers. But that could be as simple as, at the food bank or at your local, faith-based organization, if you're connected with a faith organization of some kind, anywhere. Just becoming a volunteer, getting involved in your community, in any way, all of that is just speaks to mitigation. It speaks to resilience. It speaks to, building ourselves up, creating those links, creating that social fabric, making it strong, and helping us, get to a place where we can recover more quickly, more easily, after something happens. That's what we mean when we say resilience. And then, of course, there's all kinds of online resources, and I'll share those as well. So, very happy to do that. This is one of them, actually, ready.gov. This is a federal resource. Actually, I believe it's done by the Department of Homeland Security, and they're the ones who run the annual National Preparedness Month campaign nationwide. They're the ones who come up with the themes and kind of build out all of that information. They have toolkits available full of like graphics and social media blurbs and stuff like that. So if you and your organization are interested in participating, all of that is available in English and Spanish on their website. They also have tons of other resources about, just general preparedness for all ages, in other languages as well. So this is a great resource. Even us in EP, we look at this all the time for community resources. Um, but I do want to recognize that, in this day and age, some community members or maybe some organizations are really not comfortable accessing or utilizing, a federal resource, particularly Department of Homeland and Federal Security. So I want to highlight this resource as well, which is Listos, California. Absolutely fabulous, fabulous resource. If you haven't checked out their stuff yet, I absolutely recommend it. This is administered by the Governor's Office of Emergency Services, which is Cal OES. So we have like a local Office of Emergency Services, and that's at the county level. But then if you go up to the state level, that's just called Cal OES, and they're the ones who run Listos. They provide accessible in-language information, and their mission is to advance a culture of disaster preparedness. And so they have all kinds of materials in over 20 different languages, including some more like indigenous, like Central American, Latin American languages. I actually attended a presentation a couple years ago about it. Absolutely fascinating. They engage, native speakers or people who speak these languages specifically to help put those materials together. It's very cool. But they do have also over 20 different topics. They have a huge array of formats. It's not just like, oh, here's a poster. Oh, here's a flyer. Oh, here's, a pamphlet. They're way more creative. They have all kinds of stuff. They have, a block party kit if you want to host a block party. Because remember, getting to know your neighbors, checking on your neighbors, creating that culture of preparedness. They have a block party kit. I actually have one here in my office. I need to break it open and see what's in there. Where exactly, just you and your neighborhood, you can give out resources. You can throw a party. It's a great time. Everybody's happy, right? But they also have games. They have all kinds of stuff. So I highly recommend checking out Listos, California. They really prioritize, culturally accessible emergency preparedness information. They're a fabulous resource. Oh, and then locally, remember we talked about SJ Ready at the very beginning back then? And this is the website. So sjready.org. This is your central location for all things preparedness in San Joaquin County specifically. Again, this is run by our Office of Emergency Services, but you can find information about common risks. We talked about that, remember, at the beginning as well. In the county, it'll give you preparedness tips, there's recovery information, and you can sign up for local alerts, which is so key if there's ever something going on. For example, if you know about the TCU Lightning Complex fires just east of us in Calaveras and Tuolumne counties, there's a whole little series of fires over there, which it's far away. It's not even in the county, but it's something that we keep an eye on. And if it does become something that our residents need to be worried about, then OES would be the one sending out alerts about that kind of thing. So you can sign up for alerts there, or you can be very fancy and sign up for alerts right now. Wow, very cool. Look, I feel so accomplished. My health educator taught me how to put QR codes in presentations because we definitely didn't have this when I was still a health educator, which makes me feel incredibly old to say, I have to say. But if you want to do it right now, please feel free. Again, these slides will be shared out so that you'll have this available to you. Please feel free to share this with your clients, with your families. I really recommend signing up for especially like the SJ Ready alerts because those are going to be your local alerts. You can sign up again for PG&E outages, for example, and get that information on, oh, there's been an outage, when is it expected to come back on, that kind of thing. As well as Listos, California, they also do alerts and you can put in like your zip code, for example, and get localized alerts. So you can sign up for all of them, for one of them, whatever fits your needs. Very much recommend having these available to you. Let's see. And then Okay, so one more type of alert that I just kind of wanted to hit on and just sort of a general emergency preparedness forum is WEA. So these are wireless emergency alerts. So these are alerts that you don't have to sign up for. These are kind of more like federal level type alerts. And the way that this works, since you don't sign up for them, is these emergency messages are sent by only certain authorized government authorities to your cell phone through your cell phone carrier. So these authorities, it's for example, like the weather service can. So if there's like an impending, like really bad weather alert that's coming through, or the federal communications folks, so the FCC, they can send alerts. Department of Homeland Security can do that. A local and state public safety agency can get permission. They have to kind of send their information up and get permission, but if needed, they can also use this system. So there's FEMA as well. Of course, that's the obvious. FEMA, of course, can send alerts through this way, but some examples are Amber Alerts. I'm sure we're all familiar with that. Extreme weather, evacuations, and you can actually opt out of this if you want. So if this makes folks nervous, like why is the government sending me messages in my phone? I don't like this, which is understandable. That's perfectly okay. You can opt out. Folks can opt out of, I believe all of these alerts except for the presidential alerts during a national emergency. Those you cannot opt out of, but those are also extremely rare, so I wouldn't worry too much about those. But usually that setting is actually in your cell phone somewhere. So you might have to dig through some options, but you can opt out of the rest of these. It is a free service. Again, no sign up, and you can opt out of most of it. But I wanted to touch on these just because this is something that's kind of in our sphere as well and might be something that folks are familiar with, particularly the Amber Alert things. Okay, so that was a lot of information about kind of general preparedness. I'll shift into public health preparedness because since I'm a public health person, I kind of want to, shift and give y'all some behind the scenes information on kind of what we do and how our work goes. But does anyone have any questions at this point?
Gwen, we had a question in the chat
Oh, please,
about
yes.
the psychological first aid,
Yes.
just wanting access to that.
Oh, totally. Is it okay if I send that link once we finish? I cannot actually
Sure.
see the chat where I am, but
Yeah, no problem. You can actually
awesome.
send to like email to me.
Oh,
Feel free to put
perfect.
it in the chat once you're done, but you can
Gotcha.
also, I can send it out in my follow-up email so everyone gets it
Okay,
there.
perfect.
Yeah,
Absolutely. I will
there you
definitely
go.
do that. I'm very happy to do that.
Thank you.
Any other questions? Okay, I don't hear anything. If there's nothing else in the chat, we will keep trucking. Okay. So, oh, well, yay, animation. I thought I got rid of all of them, but apparently I missed one. Um, So let's talk about public health emergency preparedness specifically. Kind of everything we've touched on is very like general emergency preparedness. A lot of those kinds of things are what our office emergency services, what OES will handle, because they're the ones talking about wildfires. That's the one, floods, all this kind of stuff. But in public health, we're a little bit more specialized because we talk about all that stuff. We have to have kind of a working knowledge of all that stuff and be a good partner to our emergency management friends in the county. But our subject matter expertise is specifically public health, and generally that means infectious disease outbreaks. That's really our bread and butter in terms of what we're looking at. So as you can imagine, COVID was a very busy time for us. We lots to do, many things. Um, but the way that we do public health emergency preparedness, when we're not in, a huge active worldwide pandemic that is, kind of breaking the world in a way, we have a couple of different grants that we work off of to help us, provide for activities that are going to help us do better. Basically, the next time there is a big infectious disease event. So kind of our two main grants are what we call the FEP and FEP lab grants. And FEP is literally just Public Health Emergency Preparedness, PHEP. Very inventive, which we're very happy about because sometimes the jargon gets to be a little bit much in this sector. But these two grants are federal funding. They're federal in nature. And basically they come from the CDC and then it comes down to the state. And then in California, because the counties are really, big and robust and do a lot of this work. All the counties then actually do the work. So we're kind of subcontractors for the state. But our job is to help our department be ready in the case of an emergency. And then because here in San Joaquin County, we have a public health lab, a brand new one in our lovely new building here on Hazelton. We also get a lab grant as well. So our lab services San Joaquin County as well as 7 additional counties in the region, mostly including kind of up in the Sierra direction, Calaveras, Tuolumne, but also Stanislaus. Sacramento has their own lab, so they take care of themselves. But we do have some lab funding as well that helps. For example, we help support our public health microbiologists as well as buy supplies for special lab testing. But we'll talk a little bit more about it. This is all very technical, but just so you can kind of see, this is what our activities are based on. These are things given down from the CDC. So our job is we do a little bit of all hazards. We help our friends out. We help our partners out when something happens. We provide subject matter expertise because most disasters have a public health component. So if you're thinking about floods, when you have a flood, when you have all kinds of standing water, now we're thinking about waterborne diseases. Now we're thinking about, mosquitoes and mosquito-borne diseases because we know that standing water is just a breeding ground for mosquitoes, right? So now we're thinking about that, especially the time of year that it is. If there's a wildfire, then there's wildfire smoke. And now we're thinking about air quality and asthma and these other public health concerns. So almost every type of disaster will have a public health component, and we're just a support agency in those events. But infectious disease is really kind of where we are considered the subject matter expertise, and we tend to run those responses. But just so you can see, these are things that we focus on. As you can see, health equity is very much built into our work plan. You can see it both in all three strategies here. That it's really key that we work with our community partners. It's really key that we work with our vulnerable populations, that we consider and plan for them specifically, because we all know that those who don't have resources are those who are most likely to have the worst outcomes in an event of a disaster, or a public health emergency. So we'll go off of that. That's very technical. Nobody wants to watch that. But in order to address all those activities, to do our work plan, these are the kinds of things that we actually do. This is what our program actually does. We do a lot of staff training. We do a lot of interagency training. We invite community partners when we can. If anybody has attended our pediatric disaster training that we've done a couple of times, which is all about planning specifically for our kids. In the event of a disaster. So if we need to evacuate, what do kids need when we evacuate? If there is, if something, knock on wood, God forbid, happens to like a school bus or something, and a whole bunch of kids show up to an emergency department at a hospital, what does that hospital need to have in place to take care of all those kids? How are we going to match all those kids back up with their families, with their parents, and that kind of thing? So we do a lot of staff trainings. We do community outreach. We do exercises, meaning basically we practice. Once we make plans, we have to practice them to make sure that, they're actually feasible and they work and that people understand. And also to poke holes in them. We love to poke holes in things. We're like, oof, we tried that. That's not super feasible. Actually, somebody else does it better. We're gonna write that down. We're gonna make an improvement, and then we'll practice it again later. So EP is very much all about it's a kind of a quality improvement process. It's baked into our program where you plan for something, you give it a try, and then you're like, "Oh, no, maybe we solve this problem a different way." And then you give it a try again, and hopefully it works better. If not, you try again. Um, so we do a lot of that. We do a lot of communication with our local, state, regional partners. We have mobile supply trailers of all kinds of stuff that we would need to run, like a vaccination clinic, for example. WebOC and CAN, don't worry about those. Those are stuff that we have to do, but it's just kind of so we have information systems, basically, are what those two systems are. Um, we have all kinds of emergency work plans, National Preparedness Month activities. That's why I'm here. Yay! We do risk assessments, again, finding out what should we be worried about in our jurisdiction. When something does happen, we help coordinate those emergency response processes and all kinds of other stuff. We've really, this is just kind of a small sampling, and so I can talk a little bit more about, for example, our staff trainings. We have mandatory ones, we have additional ones. There's this whole list here. We do FEMA trainings, we do California specialized trainings. Some staff have to take more trainings than others based on their emergency role, if they have one. Um, the Texas A&M Engineering Extension Service, or TEEX, they're basically training subject matter experts. They have a whole cadre of instructors who are extremely experienced and have had long careers in, with certain subject matter expertise. And then basically they come to TEEX, they learn a specific course based on their expertise, and then they go all over the country and teach health departments or law enforcement or firefighters or emergency management professionals, all about how to be better emergency management professionals or how to do a public health response better. And it's free, and they're always fabulous instructors. So I always try to sing their praises when I can. So for example, in for a health department, if you look all the way at the bottom of the slide where it says MGT 319, I just wrote the kind of the designations because the full titles of all these trainings, there would be like 6 slides of this, and nobody wants to see that. But MGT 319 is a medical countermeasure point of dispensing training. Again, emergency management and the jargon. But what it actually means is a health department, when there's an infectious disease outbreak, it means we're responsible for making sure that people have access to care for that. So a medical countermeasure just means like a vaccine or an antibiotic or something that's going to a treatment for whatever is going around, basically. So that training teaches us how to be better at giving vaccines to a lot of people, or to a lot of people over a large land area, or to folks who might not otherwise be able to access healthcare, and to consider all kinds of what if scenarios. It's a fabulous training. If anybody, we might hold it again maybe next year. We kind of do these annually, semi-annually. So if anybody wants to come, let me know. because we love having our community partners there because having your input, especially in terms of families, kids, all these kinds of things, absolutely crucial. Absolutely crucial. And then we do a lot of emergency planning. You will probably never read any of these because A, it's like boring, truthfully. It's our job to review and revise them so that y'all don't have to. Um, we work closely with our Office of Emergency Services, who also has the county-wide plans. Their plans are available publicly, so if you ever gonna want to go read the county-wide plans for when stuff happens, then please feel free to do that. OES has that all that available online, and they very much welcome public input into those things, especially, if maybe they're missing something, like maybe a population isn't planned for, or if a proposed course of action wouldn't work for your particular population, then we absolutely want to hear about that because more input means better plans, always. So we talk about all of these things as a health department. And then, okay, let me see. Next slide. Whoop, next slide. Yes? No?
Gwen, I have a couple questions in the chat. Do you want to address them
Oh,
now or you want
please.
to wait till?
We can do them now. No worries.
Okay. So, one question is says what would a community partner's role in medical countermeasure response look like?
Oh, lovely. Ah, fabulous. So there are several ways. So for anyone, so a great example is maybe if you have, maybe you want to host an event, for example. A lot of times the community doesn't necessarily want to come out to the health department for a medical countermeasure event. Maybe we're not easily accessible to them. Maybe it makes them nervous to come to a government entity. It could be any number of things, and we want to be fully cognizant of that. So maybe a community-based organization would like to host an event. So maybe our public health nurses could come to you and provide the vaccine or whatever, but y'all would be the ones hosting. You could help advertise for that particular event, like to your community, like to your populations of focus. We try to do our best to provide culturally competent, information and outreach and all these kinds of things. But truly, y'all are the ones who know. Like at the end of the day, even though we're kind of the grassroots government, really the ones who are in the community are y'all. And that's something that I think we as the health department, as local government, should be cognizant of. You're going to know how best to address your community, and they will probably feel much more comfortable coming to y'all, people they talk to more regularly, who provide services they rely on. Um, Coming to y'all for an event. So you could host, that's a great way. Like I said, you could provide outreach for this event. That's also a great way. If it's a language that we don't have in-house, like maybe we don't have a nurse that speaks Hmong or something like that, then interpretation services are always critical, absolutely crucial, so that we can provide the health information to them that we're required to provide. We need to provide them the vaccine information. They have to provide what's called informed consent. We have to do our due diligence in making sure they understand the treatment that they're looking to receive. And so interpretation is absolutely crucial. You also help us design the events in a way that is, more beneficial for the community, more easily accessible to the community. And that can be something as simple as, no, we can't have this event at 3 p.m. on a Tuesday. No one in our community will come. Everybody's working. Everybody's picking up their kids. Everybody's working. Nobody's coming to an event. We need to have it on a Saturday at noon by the farmer's market, like because there's or not the flea market. It's better to y'all go out to the flea market. You need to have it there. People show up there. They understand that that's a gathering place. People will be there anyway. So just the input and the knowledge that y'all have of your communities and what's going on and just where people will be is crucial as well. There's honestly, I could go on and on and on, but y'all have a crucial role is the takeaway from that, and we're always very happy to have y'all come join us because, like I said before, the more input, the better. Absolutely always. And it doesn't just have to be culturally related or language related, even things where it's like, maybe the only way to get to the clinic is, I don't know, maybe we host it in a park, but maybe the park is not super accessible. Maybe there are curbs everywhere and there's no ramps. And so our community members in wheelchairs would have a hard time actually, they might be able to pull up to it, but they wouldn't be able to enter the park. So maybe we need to be aware that either we need to bring the services to them in the car, or we just need to find a better place where they can directly access services. So even for things with our community members with disabilities of some kind, um, low vision, hard of hearing, deaf, having resources available in Braille or having ASL, folks who with ASL skills available. Like I said, I could go on and on and on. We love to hear from y'all. Oh, I see the other question
There,
though.
yeah, there were a couple other questions. So one says, can we have a list of trainings offered to agencies by the community outreach team? Maybe it's in reference to the staff training slide that you reviewed.
Right, I got
Yeah.
you. A lot of those trainings are actually online, so I can get a list together of the online trainings. Most of them are through FEMA, not all of them. I will say a lot of them are a little bit more technical, so I'm just going to warn you ahead of time. They're a little bit boring. Like they're required for us. If you're interested in going through them, that would honestly be fabulous because it'll give you a really solid understanding of what we as EM, as EP folks are doing on the back end, and the structure that we're required to go through. And it would just make any integration really seamless, I think. But I just want to give you like kind of a fair warning that if you don't finish it, I understand. Even those of us in the field, those trainings are a little bit infamous as being a little bit of a power through kind of moment. But I'm very happy to provide those to you because, again, we're always happy to provide more knowledge when we can. So let me
Yeah. Y-
write myself a note, Giovanna, if it's okay for me to send that to you as well.
Definitely. Yeah, I was just going to say that. Just go ahead and send it to me and I'll include it in my wrap up for this meeting. And then we had
Beautiful.
another question.
Oh, I love
Who
these
who
questions.
is the best contact to arrange for community outreach? We are interested in having a vaccine clinic.
So for that, we can get you connected with our disease control team. It is flu season currently, so they're out doing all kinds of flu shots. It's also, I mean, it's kind of always COVID season. That one's a little more complicated because they keep changing the eligibility requirements and all that kind of stuff. But I'll have all of our contact information at the very end of the PowerPoint. So you can email any of us and we'll get you connected. Your best bet will probably be either our health educator, her name is Sydney, she's lovely, or you can send it to our EP team email, which again will be at the very end, or to me. That's great too.
And this slide deck will go out after the meeting and the follow-up email, so you'll have that information there as well.
Exactly. Perfect.
Thanks.
Um, cool.
I think that's
Okay, I
it
think that's
for the
it.
chat. Yeah, for now.
Oh, lovely. So DOC, I'll just run through this. Again, this is just part of what we on the back end, this is part of our structure for how we need to operate when there is an emergency response required. It just helps us be efficient. It basically means instead of your normal everyday job, you get assigned kind of a new emergency response job, which we try to keep that emergency response job as similar to your day job as possible to, kind of reduce friction and just sort of reduce the stress on folks. But it just helps us to designate folks in these roles so that we're not just sort of randomly going to people saying, hey, can you do me a favor? Hey, can you do me a favor? Hey, can you do me a favor? Um, by giving them these emergency response roles, we're designating that responsibility to them and saying, okay, now that you're in this role, you have to come to these new emergency response meetings we have. You get all the updates. Everybody's on the same page. We can work together more seamlessly. And we call that a department operations center, the physical location where everybody is. So there's a picture there that you can see. There are vests. Nobody ever wants to wear them, but there are vests because we look official, right? And it usually has your your emergency response title on the back. And it helps us run more smoothly and just make sure that our departments, essential services keep running. Because even if there's a big measles outbreak or something that we need to handle, that doesn't mean that we can stop providing WIC services. That doesn't mean that our home visiting stops. That doesn't mean that our epidemiologists don't keep looking at data to identify maybe other concurrent outbreaks. It just helps us manage the two sets of responsibility, the everyday stuff we need to do anyway, and the actual response itself. Oops. Sometimes my arrow keys work and sometimes they don't. This is one of those sometimes they don't. Okay, there we go. But really, the key takeaway from all this is we absolutely cannot do any of this without partners. We're just one department at the end of the day. Um, and even though we have a fairly wide-ranging set of responsibilities, we cannot do it all. Nobody can. So we work very closely with emergency medical services or our EMS folks. Those are the ambulance people. They coordinate the ambulances. They're not the ones in, it's not the paramedics themselves, but it's the county agency that helps coordinate ambulances. And they do a lot of emergency response related to hospitals. So they're fabulous partners, OES, who I've mentioned several times, of course. Our neighboring counties, we talk to them all the time because we all have similar risks, right? We're similar counties. We share resources when we need to. We share information. Trainings that we hold are usually open to our regional partners as well because when our region is better prepared, we're better prepared. So we love it when they're able to come join us. CDPH, of course, the state, they're our funders, and they're also a source of technical assistance and updates from our federal partners, which is very crucial in this day and age. So of course we work closely with CDPH, hospitals and clinics, absolutely, healthcare partners. BHS, behavioral health. We talked about psychological first aid and all of that earlier. Community and faith-based organizations, how could it not be? We're here, right? It's like y'all are so crucial to all of this entire process. School districts, universities, law enforcement, fire departments, and elected officials, of course, because usually when there's an emergency, they like to know what's going on, right? So we absolutely have them in the loop as well. And then the last piece really is I talked about FEP and FEP Lab, our emergency preparedness. We have one more smaller grant that's called Pandemic Influenza. We just call it PanFlu, which is specifically, even within public health preparedness, PanFlu is specifically planning around for a respiratory pathogen pandemic. And you might say, "Ooh, that sounds very familiar. Didn't we have one of those?" We did. There was a grant this whole time that was helping us work on it. It's a very small grant. And it's for any respiratory, so MERS, SARS, COVID, um, flu, of course. That's kind of the big one we know about every year. But anything with pandemic potential, this also covers things, Ebola, like, kind of the scary stuff that you hear about that's, very, very virulent. But it's just important. It's important to make sure that everything we learned from COVID, because we learned a lot. Oh my goodness, we learned so much. Making sure that we take those lessons that we learned and actually apply them moving forward, because otherwise, what's the point? Nobody wants to reinvent the wheel every time something bad happens. That's just that way madness lies. So it's really crucial with the work we do with this grant to we do flu activities every year. We work with our school districts. We work with again a lot of our community partners, provide education information. If anybody would like an educational presentation about flu, we have that available for you. Our wonderful health educator Sydney has a presentation that she can come out and do if anyone is interested in having that for either, I mean, it could be your office staff. We would love to come out to a community event that you're having and provide information. We're always happy to provide that for y'all. And then on that note, because it is flu season, small aside, no health department presentation would be complete during flu season without a small plug to please get your flu shot since it's now flu season, as well as your COVID shot if you're able to do that. So, for yourselves, for all of your families, your clients, everybody you work with, please get your flu shot. We're already seeing actually fairly high flu rates, as well as COVID rates, and it's very early in the season. It's only September, but if the flu shot is not available where you are yet, it will be in the next couple of weeks. So very much encourage, if there's one, even if you don't care about emergency preparedness, if there's one take-home message you take from this presentation, please encourage people to get their flu shot. And if people are hesitant, which we fully understand, there's a lot of vaccine hesitancy going around these days. Again, we'd be happy to come do a presentation. We can bring a public health nurse a lot of times. We'll have to coordinate that in advance, but a lot of times we can bring a public health nurse. If you think that would be beneficial, we do have public health nurses who speak Spanish. So we hope to hop right over that little barrier. So just please let me know if you're interested. And then, oh, and here's our resources. Please feel free to visit any of these places, download the resources, share anything you think is helpful with your clients, with your families. Um, there are templates for making a plan. There's templates for, communication, phone number plans, that kind of thing. There's templates abound, basically. Nobody has to create anything themselves. It's all there. Red Cross is there. If your agency would like COVID test kits, we have approximately a billion still, and I do believe that they're set to expire in October, November. So if you would like some, please, please, please email us. We will get you connected with the wonderful person here in our department who handles those orders. Please take them. Please take them. We would love our wonderful facilities guy would absolutely adore us for clearing out some of his storage space. So help me earn brownie points, please.
Gwen, are
Yes.
are agencies able to order large amounts of the COVID kits? Yes. Okay.
We have like 190 cases, and there are 90 kits in each case, and
Okay.
there are two tests in each kit. So if
Oh,
you multiply all that out, it is approximately a billion.
a lot. Yeah.
It is so many. Please order
Okay.
them.
Great.
We're very happy to supply you. You'd probably have to designate somebody to come pick them up from us. We don't have the capacity to deliver anymore.
Mhm.
But yeah, come on down. Come on down. Email us and we'll get you set up.
Great.
Cool. Okay. So something else, if we have a couple minutes, you told me I had like 60 minutes to present. So I put some discussion questions at the end in case I needed some extra
Yeah, you're
time.
good. Go for it.
If we have a couple minutes, I kind of wanted to ask some questions to the group. And I know people prefer the chat, but please feel free to come off mute. You don't have to turn on your camera. It's okay. I'm not judging. I kind of wanted to ask some questions to the group about, what do you see in your work? What do you think about emergency preparedness? What have you maybe heard from your clients, from your families, on this topic? So I have 3 or 4 questions that I just kind of wanted to ask to the group. Oh, I see a hand raised. Jennifer? Yes.
Hi. What I see in my community is that not a lot of people have a set like disaster plan or anything like that.
Mm-hmm.
Even if there's always, even if I feel like a lot of the people that do go to our community events, it's the same people and they do see the resources there, they
Sure.
still don't have an action plan. I feel like sometimes we have to lead, pull the horse to water and make it
Mm-hmm.
for them. And
Mm-hmm.
unfortunately, we don't want to do that, but sometimes I feel like
Right.
it's needed.
Right, right.
Yeah.
Yeah, no, I definitely understand that because EP is very much one of those subjects where you're like, yeah, no, it's important, and then you immediately forget about it. And then
Yeah.
something happens, you're like, oh no, I wish. Um,
Yeah. During COVID,
I
I feel like everyone kind of started and
hmm
then everyone kind of relaxed and
Right.
but
Life
it's
happens.
not the only disease out there or
Exactly.
disaster or anything. There's always something that you
Hmm
might need us be prepared for. And maybe
hmm
that's just me because I'm a mom and always trying to have either a generator, flashlights,
hmm
stuff like that. You know,
hmm
the paperwork isn't very important. I think people always fail to realize paperwork is very important. It gets wet,
Very
it
important.
gets lost,
Hmm
and
It's
that's, yeah, very
crucial.
important. Yes.
It's crucial. And something else I tell people, that's kind of a, pro tip is, if they need to evacuate and if you're evacuating in an area that's got widespread power outages, I know we saw really huge brownouts in Northern California too. Every time there's a big wildfire, there's really big brownouts in Northern California. Luckily, we don't tend to have them too much, but if for some reason you need to evacuate and you're in a big outage area, you want to make sure you have cash with you in small bills specifically. Because if you go to a gas station, convenience store, whatever, and you're like, I don't have any water, or you've got to get gas or whatever, and there's an outage, they're not required to provide you with change by law. So your $2 bottle of water is now $10 because that's all you had was a $10 bill. So I highly recommend that folks, for example, carry cash and small bills specifically for evacuations and things. And it's just like it's those kinds of tips and tricks that we really love to provide folks because it's just like I said, we're professional what ifers, and we end up with tips that we want everybody to know because trying to think through all of that in your daily life when you've got a million competing priorities is absolutely exhausting. And I think folks really feel that whenever they try to sit down to do that planning. Um, if they do sit down to do that planning, it gets very overwhelming very quickly. I can absolutely understand. Definitely. Anyone else? That was great. Thank you, Jennifer. And then, kind of a second question I had was we talked a little bit about hazards and risks in our county, but when you think about your populations and those you serve specifically, your clients, these families, what are other risks and hazards that you think would be something that they would be concerned about? Yeah.
Hi, I'm not sure if this pertains, but I know in our county there's a lot of
Mhm.
individuals who live in the streets.
Sure.
And whenever like in certain parks, I know clients have told me like, oh, I took my kids out to the park and there was like
Mhm.
paraphernalia and like,
Ah,
drug usage. And
sure.
I know it's part of public health because that's a concern for the children, the community, and everyone involved.
hmm hmm Yeah, that's absolutely something that is concerning because I don't know if you know where public health is, but Hazleton, we're right next to Shribley Park,
Oh,
which
yes.
right, that's all I need to say, right? Um, so I no, I absolutely understand. Yeah, that's a concern for sure. hmm Anyone else? That was great. Thank you, Clara. Let's see. I have several of these, so we can go on for however long I have.
Hi,
Um,
Gwen.
sure. Yes,
Jeff's
please.
friend from First Five, and this kind of
Hello.
relates more to the previous question, but we
Right.
talk about having emergency plans for like
Mhm.
power outages and things like that. But
Sure.
I'm an older person, live alone,
hmm
and my son lives just down the street. I think preparing him to know where all of my medical information or where
hmm
all of my special documents are in case something where I should be unable
hmm
to access that is just another type of emergency preparedness that
Absolutely.
maybe families don't think about. That,
hmm
if something happens, where is my stuff? How's he
hmm
going to find it? And that type of thing. So,
Absolutely. No, that is a perfect, I mean, like a crystal clear, perfect example. That, it's preparing for the whole community, for considering the unique needs of every family. And like you said, especially because y'all don't live together.
yeah,
Yeah, that's absolutely crucial, to making sure that he's aware of, your specific needs, of the things you need to take care of those needs.
yeah.
That's a perfect example. Thank
And
you.
that might be a way to get a family to start thinking about emergency
Mhm.
preparedness.
hmm
I think it was Jennifer who was saying it, people know they should do it, but just don't do it. So maybe starting with
Right.
one form of preparedness,
hmm
then we, as we're interacting with them, can build upon that. Okay, now that you've got that part done, what happens if? So
Right.
just thinking.
Absolutely. Absolutely. No, that's an excellent point. Excellent point. Cool.
One comment in the chat was flooding in our community to address
Oh,
this
flooding in
question.
your
Yeah,
community. Oh yeah,
yeah.
absolutely. Flooding um is most definitely a concern. That's the last couple times that we've had to open a shelter here in this county in the last maybe 3 or 4 years. It's been for flooding. We have some levees that we're missing some maintenance basically, and they failed a little bit. That's kind of the best way to put it. That's the technical term, failed a little bit. But yeah, and it led to some flooding. So you are 100% correct. The Delta is huge. So there are hundreds of miles of levees in the county, plus of course the river and everything. Um, no, that's a fabulous point. Let's see. Actually, I think I saw a question about, oh, how long would the test be? For the COVID test, accurate after the expiration date? Oh, that's also a fabulous question because So sometimes the expiration dates they get extended basically the shelf life gets extended and usually if that's going to happen we get a letter from the state saying the shelf life has been extended to a certain date. So sometimes that happens and sometimes it doesn't. So my best answer for you is I don't know, actually. Um, that's a great question. We usually try and get them out and get them into folks' hands by the expiration date, but sometimes they get extended. If that's the case, I would imagine we could probably do some outreach to you to like make sure that y'all know that okay, well, if they said okay, it's fine till January, then awesome. But it might, I'm not sure about this particular stock, but it might also be that these were all have already been extended and this October, November date is the extension. I'm not 100% sure on that, to be honest. But I imagine our person who's the lead on that will probably be able to tell you. Good question. Lovely question. Cool. This question, if we want to talk about this question, this is probably my favorite one here, um, which is what vulnerable populations or, other just kind of specialized needs would you like to see addressed in county emergency plans or in emergency communications, with folks? Like, has there ever been a gap that you've noticed where, maybe during COVID, you saw communications that were put out, or you saw plans that were made, or you saw response actions that were taken, and you were like, that's not really going to work for, fill in the blank. Or, oh, I really wish they'd done XYZ because it would have been better. Um, like, don't be shy. I know everybody's had those. We are not perfect. We're always looking to improve. Ooh, Jennifer, yes, please.
Um, I have a child that's on the spectrum. So
Mhm.
the Stockton Police Department has been doing a new thing where you're kind of like pre-registering them to um kind of be I don't know if I know how to put it, be distinguished as a child or adult with special needs.
Ah,
But
okay.
what is it that you guys also might have? I don't know. It's, I'm just gonna use it as an example. Maybe like I know they have the bracelets, but the kids don't wear bracelets all
Oh,
the
sure.
time.
Sure.
Like, what do you guys have to distinguish
Mhm.
certain people with special needs? And of course, not pointing them out, but in a case of emergency, stuff like that.
Oh, I got you. That is a great point. Um, Ooh, that's a lovely question. Let's see. I'm thinking about, so in terms of public health and either communications or actions during a public health emergency, um, I'm thinking maybe our communications could be a little bit more understanding towards that, and maybe we could include some like best practices for providing a medical countermeasure, providing a vaccine or an antibiotic to a person on the spectrum. Um, an example that comes to mind, just kind of offhand, is something that we did during COVID that I think was actually pretty successful. Was we actually had a homebound vaccination program that folks could sign up for. There was a link basically to a survey on our website that said if you need a homebound vaccination, if you're eligible, then please sign up here and we'll give you a call. We'll come out to your house. A nurse will come out to your house, give you the COVID vaccination. Now, granted, you had to be eligible, but generally, if folks signed up, we would at least give them a call and just like talk to them and find out, okay, kind of what is the situation? Because the technical definition was, are you on Medi-Cal? Can you leave your house? But we had a lot of folks utilize that who had behavioral health needs or who were on the spectrum on the more severe side, because it's just so traumatic for those folks to leave their house and go do a new thing and get health care and be in public and have a shot. It's a lot. I mean, for anybody, it's a lot. And so we were able to provide services in the home in the presence of family members. And family was able to organize that with us, and they could have, we had one we had one we had one case where we needed to call the family like 30 minutes ahead of time because they had needed two extra family members to leave work because they needed three total family members to help with the child, so they wouldn't have, kind of wouldn't run into crisis during the vaccination process. So during emergencies, at least we can do something like that. But I think for us, it's probably a lot of shelters, for example, are incorporating some new things for folks on the spectrum. They're like sensory. Oh gosh, I don't want to say it wrong. Is it like sensory, like less sensory areas? That's not right. Um, what is it called? Please help me. Sensory safe zones
Yeah,
or
you're those are appropriate words. Yeah. Those
oh, okay.
free safe. There's a lot of
Yes.
places that have like corners, like kitty,
Mm,
but for
mhm.
the classmates, like kitty corners or quiet corners, or they just name them their own
Yes.
things. Yeah.
Yes. Okay. Okay.
Sensory.
So, oh, that's nice. Okay. Sensory safe zones. Okay. Um, what was I saying? Oh, shelters. Yes. So shelters are kind of starting to incorporate those kinds of things into their planning. So, and traditionally, shelter planning is like, all right, we have these cots for families over here. We have these cots for single people over here. We have the food area over here. We have the restrooms over here, the hand washing here, and this is where people park. And that was kind of it, honestly. But I think they're really starting to incorporate some particular access and functional needs. That's kind of our EM blanket term for anybody who just needs a little something extra for whatever reason. It doesn't matter. Almost everybody has some kind of access and functional need. But sensory safe corners or areas so that the kids can feel better, or it doesn't have to be a kid, to be honest, anybody on the spectrum. But also making sure that they allow pets in. There's a pet area for those folks because we know people don't like to leave their pets. They won't come into the shelter if they can't have their pet, um, and all that kind of stuff. So that's no, that's fabulous. That's such a good point. Anybody else? Oh, Your Way registry with
That was just
Stockton.
yeah, Jennifer was mentioning the resource with
Oh,
Stockton PD. It's called Your Way Registry. You can go to the site and
very
register,
cool.
yeah,
Very cool.
individuals. Yeah.
Um, oh yeah, address homeless youth. Absolutely. Absolutely. Oh, that is such a hard population. That's just so heartbreaking in and of itself. Yes. That's a tough one. Yeah, I think we have room for improvement, I think, in our planning and our communications to those folks. Absolutely. Nice. And I was like, Joanna, just stop me whenever I need to stop, because like I said, I have several questions and we
Yeah,
don't
I
have to go
think
through them.
this might be a good
It's a
place
good
to
spot.
pause. Yeah, and
Awesome.
see if there are any other questions just in general about your presentation, just to make sure we have time to cover
Let's
those.
say. Any other questions?
And I know there was interest in seeing those contacts. So, like, I think
Yes.
you
Ooh,
had some contact.
there
Yes,
we go.
maybe people can
That's the
take a
one.
quick. Hmm.
So yeah, this is our team. Myself, Sydney, our lovely health educator, Raphael, our emergency planner, and then our team. If you don't want to email any of us in particular, or if you're just not, or if you get a bounce back message, somebody's out of office, then please feel free to email the team email. That's always monitored. Somebody will get back to you.
Thank you, Gwen. We had one other kind of follow-up question to that homeless youth
Mhm.
comment, and it's what services do you have for homeless youth?
Oh goodness. Um, I'm thinking about for homeless youth in terms of honestly, in terms of public health emergency preparedness, not much, if any. In terms of just general public health, homeless youth, I don't know. I'm thinking about the intersection with our foster care system. A lot of times our homeless youth are in the foster system and they've run away or something. We do have foster care nurses who help manage, the healthcare of these kids. Ooh, that is a difficult one though. That they tend to be mobile. They tend to be the highest risk, the absolute highest risk for everything, for adverse health outcomes, I mean, really any adverse outcome, not just health. That's a really, really tough one. We don't have a lot, to be honest. The only thing I can think of is kind of our foster care nurses, who do case management for them. Um, big piece of that is psychotropic medication. A lot of them have mental health disorders or mental health illnesses that they help manage that process. I'm wondering, I know we used to have whole person care was used to be a program under public health, and they case managed some of our residents with like really just complex needs. You know, it was just they homeless, substance use disorder, also mental illness, you know, also just our folks who need just a lot of support and services. However, that program had to, I'm not sure what their population of focus was. I think it was primarily homeless, unhoused, unsheltered, but I know they've actually moved because of funding issues. They've actually had to redirect, and that program is now housed under correctional health, not public health. And now their primary population of focus is just the justice involved folks. So I'm not sure that they would, I don't know if that includes like, you know, kind of juvie youth folks. I was like, I'm racking my brain. That's kind of all I'm coming up with. But I do know their manager, so I can find out a little bit more detail probably if they do anything for our youth, because that's a great point.
Yeah,
And that
thank
is
you.
such a hard population. Bless you for doing that work, because oh my
Yeah.
goodness, that's rough.
Thank you so much, Gwen. This is
Absolutely.
just lots of good information. I know on a
Totally.
personal note, have new motivation to finish my emergency kit. I started it some time ago and I just never finished it. So I'm just like, it's time to finish up
Mhm.
my emergency kit. Okay, one other follow-up question to that. Could you please provide me with a contact person that works with youth? Our office is getting a lot of youth. So
Oh,
maybe
sure.
if you want to pop that into the chat, if there's someone on the PHS
Um,
team that she can
w-
reach out to.
yeah. Let's see, Marie Antoinette, I'm sorry, what organization are you with? I want to try and get you to somebody who might be in the same vein. Are you with maybe I don't know, Cap C or was that would
Marie Antoinette, if you're not able to unmute yourself to share, you can grab Gwen's email address from the slide. Civilic. Okay. She's Central Valley Low Income
okay.
Housing.
Low income. Okay, sure. Sure. Okay, that's interesting. I'll have to look into that one for you. I'm not
Uh,
100% sure.
Hi, all. This is Annette, and I kind of missed the original question, but I'm with St. Mary's Community Services,
Mhm.
and I might be able to give some information regarding the youth. I didn't. What was the original question? I missed that.
Just
there's,
any services.
yeah.
Okay, I'll go ahead and put that in this chat then. Thank you.
Thanks, Annette.
Awesome. Thank you.
Thank you. Okay. Gwen, again, thank you. This is great information. Just a reminder that a recording of this meeting will go out. So you'll be able to listen back if you missed any of Gwen's presentation or if you want to share it with some of your team members or other staff within your agencies. And the slide deck will go out as well. So you'll have all the contact information that you see on the slide, as well as everything that she presented in the slide deck that will go out after this meeting. And then oh yeah, so there's another question, Gwen, about like a sample emergency kit. I know there are a lot of handouts online, but
Oh
if
yeah.
there is like a specific handout that you think would be most useful for those that, are working with families
Mm-hmm.
with young kids, if you want to send that to me
Hmm.
and I'll send it in my follow-up. So if you, just a side note, if you did not receive a direct invite to this Community Links meeting from me, then I may not have your email address included, and maybe this invite was forwarded to you, and I want to make sure you're included in our distribution list. So I'm going to put my email address in the chat, and so if you would like to just go ahead and shoot me an email, that way I can make sure that you're added to our distribution list, and you'll get the follow-up email as well as any future invites to community links. Okay, and there you go. All right. Thank you, Gwen. I'm just going to go ahead and share out just a couple of updates with you all and reminders. So you guys see my screen okay? Yes. Okay, great. So, uh-oh, didn't mean for that to happen. Sorry about that. Okay, Family Day at the Park. Just a reminder that's coming up very soon. We are a sponsor of the Alphabet Alley. We have been for many years. So this is an event we hold dear to our hearts, and we just want to make sure that we get the word out to families that this event is happening. It's a great community event, free, lots of resources, lots of fun. Please help spread the word about Family Day at the Park coming up in a couple weeks. We also have an invitation has been extended to agencies in the community that have home visitors or parent educators that work with families. There's a father engagement training series that's coming up. SJCOE is the host for this training. And so there are a number of sessions that are being held. There is a stipend being offered to participants. These sessions are on Saturdays and they are, for the most part, full day sessions, like 5 or 6 hours. So just keep that in mind. But you can, I'll send the flyer that you see on the slide here, I'll send that out in my follow-up. So if you're interested, you can reach out to the contact listed, or you can scan the codes or click the links to go to the sites to get registered for these events. Okay, and I have a couple other trainings that are coming up, and I'm actually going to hand it over to my colleague Kathy, who's going to share more about them.
Hi, Giovanna. Hi, everybody. I'm Kathy Sprentz, and I'm one of the first 5 staff. And these are both 100 and 400 on here, Giovanna?
Yes.
Okay. So this first you see here is trauma responsive and resilience building for early childhood educators. This is the beginning module for trauma responsive care. It's a 6-hour training that's offered in 2 parts. You'll see that's coming up on Monday, October 6th, and part 2 is Tuesday, October 7th. This is a free training, and it is expected that you attend both sessions for this. And you've got the QR code there to register. And then the next version is module 400, which is really about family engagement and trauma responsive care. And this one is, again, a 6-hour training offered in 2 parts on Tuesday, November 4th and Thursday, November 6th. And again, there's the QR code to register. And again, this is a free training open to anybody in the county.
Great. Thanks, Kathy.
Yep.
Flyers for this will go out in the follow-up email as well. We just want to spotlight Read to Me Stockton, which I think the word is getting out that Read to Me Stockton is now expanded and it's countywide. I believe Mary is on. So
I
Mary,
am. And I
yeah.
wanted to say a big thank you to everyone for helping us spread the word. In August, we signed up more than 900 new children,
Wow.
which is pretty amazing. We
Yeah.
know that's just a tiny percentage of the children in the south part of the county. But if you can help us spread the word that every single child who lives in San Joaquin County, from the day they're born until the month they turn 5, can sign up and receive free books. And remember, we do have bilingual books available. It's the same book, it just has both English and Spanish on the page. And I'm preaching to the choir here, I know, but if a family has 3 kids under 5, they should each be signed up. It's completely free, so help us spread the word. And it would be great if every single child that you come into contact with gets the free books.
Great. Thank you, Mary. Okay, so we've got a couple minutes remaining. We just want to give space to anyone else that has any updates or things happening or resources you want to spotlight or good news you want to share. Just pause for that. Feel free to unmute yourself and share.
Hello, everyone. This is Sally here with the
Sally?
YMCA. It's great to see everyone today, and thank you, Gwen, for the presentation. That was very helpful. I just wanted to share that we have Why Families Matter. It's going to be on November 13th of this year. We will have a great presenter there. His name is Des, and he is a survivor of like a disease and infection. He's currently a wheelchair professional tennis player. He will be there to speak about his inspirational story and how his family survived the infection that he was going through to and becoming an athlete. And with that, we will be doing this event to sponsor our sports program. So all dollars received from this sponsorship and campaign will go towards all of our students or the children of our community who are applying for our fee-based programs, and then we usually use the funding to help pay for a partial of their fees, so it can waive that fee for families, and they can join the sports program within the YMCA. So I can share in the chat if you're interested in sponsoring, or if you'd like to attend, you can purchase a ticket as well. Thank you.
Thank you, Sally. Any other announcements, updates? Feel free to unmute yourself if you have anything. Okay, well, I will take that as oh, sorry, I want to miss anything. Great information. Thank you. Okay, so we've got something from Chanel. So SCDD, I'm not sure what that is. Oh, okay. I got an email. So I'll make sure to include this update in my email. Thank you, Chanel. But they're looking for some input on the state plan. So look out for that uh, in the email. And then Annette has placed some information about youth services. Thank you, offered by Prevail and Youth Crisis. So there are phone numbers there for those that were interested in more information about youth services available in our community. Please go to the chat and grab those phone numbers so you can do some follow up there. Okay, we're at time. Thank you all so much for your time today. Have a wonderful, wonderful weekend, and we'll see you next time. Bye bye.